Next up, let's talk about the neck, also known as the cervical spine. So, similar to the vertebrae of the lumbar spine, we have vertebral bodies, which are kind of cylindrical bone, and just behind that, on the backside of those stacks of cylindrical bone, is the spinal column, where the nerves run from the brain down into the spinal column. And then the nerves exit the spine at the spinal foramen, which is the hole where the nerve roots exit. And we have the facet joints, which is where one vertebrae touches or comes into contact with the vertebrae above or below. And we also have discs, which provides shock absorption and allow for movement and mobility of one vertebrae relative to the next. There are a few common things that happen. A nerve can be getting irritated at the level of the spine and causing numbness or tingling down the arm or into the hand. You can also have nerve irritation that happens out away from the neck. So sometimes it's coming from the neck, sometimes it's happening at the thoracic outlet, which is the space where the nerves travel from and exit the thorax and come out into the extremity of the arm. And they can get irritated there. Nerves, like we've said, like space, they like movement, and they like good blood supply. So if any of those things are being obstructed at that thoracic outlet, it can lead to numbness and tingling of the hand or arm, or loss of function and strength of the hand. If you're having a progressive loss of strength or function in the arm, you need to be seen in person and evaluated properly. Same thing with the legs. If you're having loss of strength or function in the legs because of potential nerve damage or irritation, you need to be seen in person. You can get numbness and tingling that kind of comes and goes and isn't leading to a loss of strength or function of the extremity, and that is something that you can typically work with. However, if it's not getting better in 4 to 6 weeks, again, you should be seen in person and have that looked at more thoroughly. I would encourage that. And so you can have referred pain from the facet joints, just like you can at the lumbar spine. You can have nerve irritation that happens at the space where the nerves come out and exit the spine. That can happen further down their path as well. There's muscles in the shoulder that can sometimes pinch on or irritate a nerve, and that can happen at the elbow as well as the carpal tunnel. There's several spots where the nerves could potentially be running into problems. Nerve pain, again, is going to be associated with numbness and tingling, a lancing sort of pain where you could almost draw a line of that pain, certain patches of skin that are numb, and loss of strength of certain muscle groups, or quicker to fatigue. That's a common thing with nerves, is that if they're not happy, the muscle that's associated, that nerve innervates, will be more quick to fatigue or tire out more quickly. Something that's really important when we're talking about the neck is our posture. So if we are sitting at a computer all day and our head is forward, that is problematic for the spine at the neck and can lead to neck pain. You can also get headaches that are referred from the neck, called cervicogenic type of headaches, and that often originates at the upper part of the neck. So either the vertebrae of the upper neck, like C1, 2, 3, or the muscles at the upper part of the neck will refer pain up and reproduce headaches, and that's called cervicogenic type of headaches. You can also get referred pain that causes headaches from like a trigger point in some of the muscles, like the upper trapezius, which we talked about in the shoulder anatomy video. Sometimes the levator scapula muscle will have trigger points as well. A trigger point is just a point of dysfunction within the muscle where the muscle is kind of bound up. There's often inflammatory biomarkers, meaning there's inflammation surrounding that area, and that area is a little bit painful in the muscle and can refer pain out away from that trigger point to other parts of the body. So that is the neck, and that is a few common presentations of the neck. and some things that can go wrong and what that looks like. There will be some videos to address neurodynamic exercises, which you can plug into the search bar, and that will help with if there's any irritation to a nerve or a nerve is feeling a little bit unhappy. Those neurodynamic exercises can provide movement and maybe increase blood supply for that nerve, which it will like and should help decrease your symptoms. As well as exercises for the neck, there are muscles called the deep cervical flexor muscles, which you can look up in the search bar. And those muscles are really important for helping to support posture of the neck, as well as collaborate with the big mover muscles. So those deep cervical flexors, as well as the multifidi muscles, similar to in the lumbar spine, when those muscles all work together with the big mover muscles like the upper trapezius and the levator scapula, as well as the sternocleidomastoid muscles, which help to rotate and side bend the neck. When everything is working together and your posture is good and there's space for the discs and the nerves and the joints, things tend to be pretty happy. So there are several things that you can do to optimize what's happening at the neck. That gives you a quick rundown of some of the structures and some of the potential problems that you might run into at the neck, and there will be associated videos to help give you an idea of what all to do about that.